Thank you so much. My name is Antony Gitonga, the CEO and founder of Antony Gitonga Foundation. And today we are hosting a free medical camp here in Othaya in collaboration with the Blue Star Hospital here in Othaya. And basically our objective is to be able to promote access to healthcare to our people, our mothers, our fathers, our siblings, our children, so that everybody has access to basic healthcare here in Othaya. Healthcare is very important. I believe that as a people, for us to be able to achieve progress, for us to be able to go where we need to go, that cannot be possible without good healthcare. If we are not feeling well, from mental health to general health, and so on and so forth. And that is why, for me, as a leader and as a local of this community, I take the issues of healthcare quite seriously, to be able to bring partners on board, to be able to work with like-minded parties, and to be able to bring healthcare closer to the people. This is not the first medical camp that Antony Gitonga Foundation is conducting. We've done many of these, some of them gender-specific, some of them disease-specific, some of them to take care of our children, but this one in particular is because there is a huge gap when it comes to access, and that is why for me collaborating with a hospital is also quite important, to be able to bring experts on board, to be able to mobilize enough medicine for our people, and that is what we are doing today. We are very excited. We are able to reach close to 3,000 people today. That is our target. The numbers are still coming. In the morning we had challenge of weather kidogo. It was a bit rainy, a bit misty, but I'm excited that people are still coming in because we have more than 100 doctors on site, different professions, different disciplines, from neurosurgeons, general physicians, gynecologists, to look at and be able to treat our women, our ladies. We have pediatricians to be able to take care of our children. We have oncologists for the issues of cancer. We have urologists as well. And just like I have said, we've mobilized enough medication. So the reason why we do this is our people are not in a good place, all right? The issues of lifestyle diseases, the issues of non-communicable diseases are cutting across the young and the old, men and women. And that is why we are coming together to be able to say that we want to promote access to basic and affordable healthcare to our people. So we'll continue to do this as resources allow. We'll continue to do this, and we'll continue to mobilize as many partners to come on board and to be able to do this. We do this oftenly, we do this many times, and for me as a leader in Othaya, my aspiration is to be Member of Parliament, Othaya constituency 2027. But even before that time comes, is exactly what are we doing now to impact our people. It's not just about promissory notes and being futuristic, but it's about tangible, present impact to our people. And that is why I'll continue to do this, because it is important. We cannot go anywhere if our people are not healthy. We cannot lead a people who are sick. And that is why I'm challenging all the leaders to be able to marshal resources and come and support our people. Whether you want to be elected or not, if God has placed you in a position of influence and where you're able to get resources, let's come back and support our communities. Because if our communities flourish, our children will flourish, our country will be able to flourish, and that is how we all move together as a people into the future. That people will use events and noble causes like this for political mileage. But for me, this is not the time I'm starting, all right? My foundation was established more than 10 years ago. I have done medical camps even before the 2022 elections. So if it was about doing it for office, then I would have run in 2022. But I'm saying I'm passionate enough to be able to do this for community. And now the community is getting enlightened, and they have seen people who will camouflage as philanthropists to be able to come and do this for vote seeking. But that is not what we are doing here. It's about tangible impact. It's about mobilizing resources. It's about getting doctors and experts to come and treat our people. All right? I have 100 doctors on site. If it was a political campaign, you can't tell me I have the influence to bring 100 doctors on site and to mobilize as much medicine to just come and support a political campaign. That is not the case. It's because they know that we are here for the benefit of the people. We want to condemn all those people who use, and all those leaders who use such initiatives for such events. Antony Gitonga is real, has been here for the longest, and will continue to support. And again, for me as a leader, is to listen to what the people want. All right, is to be able to engage the people. The people are saying healthcare in this country has become expensive. Healthcare in this country has become inaccessible. And that is why we are coming in to fill that leadership gap. And so we want to challenge even the government to ensure that the universal healthcare needs to be free, or at the very bare minimum, affordable to our people. You cannot tell me we are paying for SHA, which needs to be working as universal healthcare, and it's not affordable. And people are paying premiums, you know. So that is why we are here. And we continue to work for the people. And this is, it's not conditional. It's not for mobilizing votes. Actually, it's the people of Othaya who come out and say, for the good things that you're doing, we want you to be a step ahead and to represent us in Bunge, so that some of these issues can be mainstream. If we had proper leadership, we wouldn't have 2,000, 3,000 people coming out in these numbers to be able to get medicine, because we should ensure that we have enough doctors in our public hospitals, that we have enough medicine in our public hospitals, that if medicine is not free, at least it's available and it's affordable. All right? And that is why I'm saying, for me as a leader, even the desire to get to parliament to represent my people is also to say I want to mainstream some of these very important issues into the mainstream: education, healthcare, agriculture and trade, not just to do them from the periphery as philanthropists, but to be able to do it as leaders through the taxpayers' money, through the government system, because that is how it needs to be. Yeah.
Good. Thank you so much. My name is John Michael Maigwa. I'm a clinical officer at Blue Star Hospital. As a Blue Star fraternity, we have come together with the Antony Gitonga Foundation just to make sure that we hold today's event, the medical camp, here at Othaya Approved Grounds. And today has been a success despite the weather conditions in the morning. There were some chilly conditions here and there. But now we thank God that the sunshine is coming. And the expectation is almost met. The numbers is continuing to stream in. We are seeing quite a number of patients, and some of the conditions that we have highlighted, they are mostly the non-communicable diseases, the diabetes, the hypertension, and the arthritis. Those are the common conditions that we have highlighted, among others that are there, including the pediatrics issues, including the ophthalmology issues, even including the ENTs. Some of these issues, they are brought about by the lifestyle changes that we are currently not observing. Maybe some people are not exercising a lot, some people are eating too much starch, too much of sugars, too much of alcoholism and cigarette smoking. Those are some of the factors that are contributing to many of these non-communicable diseases. Today, mostly, we have pediatricians, we have gynecologists, we have general physicians. We have also general surgeons who are taking care of our patients in case they need any urgent referrals. In as much as we are doing all that, we are encouraging our patients that after today, that's not the end of the story. They should also be coming each and every week, each and every month for close monitoring and something that we call follow-up, so that at least some of these conditions, they do not reach to us when they are at extreme ends. We need also to monitor them so that we can be able to scoop the finer details in them. So we encourage our patients and our parents and our mothers and fathers here that hata ukimeza hizo dawa za pressure, ni vizuri ukae ukija kwenye hospitali yetu tuweze kukufanyia kitu inaitwa follow up, tuone kama zinakusaidia ama zinafanya kazi ama zinahitaji kubadilishwa ama kupunguzwa. So basically today has been a success. You can see the patients are continuing to stream in. So we hope by the end of the day that we shall have a substantial number, just to say that today was a success one. Thank you.
Good. Mothe ndaigua ngenete muno makiria tondu wa kuona muthuri uyu arehete maendeleo ma gututhima na gutuhe ndawa cia tuhu tondu kuma rira twaumire kuruira bururi uyu tondu umwe wakiruire mwanake uyu ningumuhoera Ngai muno amuteithie angithie bunge ndagathie gukoma athie arutire bururi wa Othaya wira tondu ona mwanake uyu ugi wake no tora wa hakuira mwai wake baki no kama kira inakio ni kiega makiria tondu ko turathugunda bururi uyu ukorwo tugiatha bururi uyu na mwanake uyu arika kuingira bunge tondu ningumuhoera mwathani aingire ndagathie gutuika ndingo ya guthie gukiraga bunge atuike mundu aguthie kurugama gatandi aria angi akoria kiuria ndiriketha bururi uyu witu Othaya warahuke mwanake githomo kiria inakio na ugurai naguo uhano wa mwai wa Kibaki hatiro tiganu macire kwerekereria nie ni ndathimwo na ndaigua wega muno na riu mwiri wakwa angiko uguo muno makiria na amenyere mathukuru na amenyerere kugiana na kihoto no tuigwe tukerete Othaya na mwanake ugu Antony Gitonga ri Ngai amuteithie aingire bunge na bururi tu kwarahuka
guthiaga na mubango mwega ni tondu haria wokira ugathie ugathondekwo na ndona ucio ni mubango mwega tondu riu ni kuinuka turainuka na mahinda maria tuoka riu tuthondekete na tukainuka na gutire handu urathie ukaga guteithika ni uraririo wega ukorio uria ukaheana mathina maku ukerirwo haria uguthie na ndona uri urigitani mwega.
Na nimetoka huko upande wa Mahira huko na nimekuja kutibiwa, sikuwa naona mzuri lakini inaodaliwa, alafu nikaambiwa niende nipate dawa, lakini yangu kwanza ni kushukuru zaidi sababu tujawahi karibuni kuona madaktari wa bure hapa kutusaidia. Hata wenye anawaalika hao madaktari tumshukuru zaidi sababu sisi hatungeweza kutetea hawa, lakini wale ambao wanakutana na hao madaktari ama wenye wako na uwezo wa kukutana na hao, kwanza ni kuwashukuru zaidi, kumshukuru zaidi. Kwa hayo machache tuseme tu bora tushukuru zaidi hata madaktari wetu wale walioko hapa na wengine wametoka mbali, tuwashukuru zaidi.